Good morning, all. Today, I want to just talk about this virus, coronavirus, that is affecting the world, the nations, and I'll probably give us information on how it spread and how to keep safe. So, what is coronavirus? As we know, according to the World Health Organization, coronavirus are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. The most recently discovered coronavirus causes coronavirus disease COVID-19. This COVID-19 is a new illness that can affect your lungs and airways. You need to know that. And it was first detected in Wuhan City, Hubei province in China. Now, secondly, we are going to see how it spread. COVID-19 spread from an infected person to another through close personal contact. The air through coughing or sneezing, touching an object or surface with the virus on it, then touching your mouth, nose, or eyes, it spreads. Health experts are still researching on other ways the virus is spread. Note that. Now, how do I keep it? How do I keep safe? How do I keep safe? Now, you need to wash your hands regularly, or alternatively, use an alcohol-based hand sanitizer to kill viruses that may be on your hands. Keep at least 1 meter distance between yourself and anyone who is unaware, coughing or sneezing. Then, the third one, and very important, avoid touching your eyes, nose, or mouth with your hands to prevent transfer of any viruses on your hands. What are the symptoms? We need to know the symptoms. Symptoms usually appear 2 to 14 days after exposure and may include a fever, coughing or sneezing, breathing difficulties, muscle pain. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Now, let's talk about the facts and the myths of COVID-19. Will I die if I catch COVID-19? Illness from COVID-19 is generally mild, especially in children and young adults. However, 1 in 5 people who catch it need hospital care. The proportion of people dying from the disease appear low, between 1% and 2%, but these figures may be unreliable. The second point, diseases can affect anyone regardless of race or ethnicity. There has been no evidence that pets such as cats and dogs can catch or spread coronavirus. Then it has not been confirmed whether and temperature impact the spread of COVID-19. Has anyone in Kenya gotten infected? That one we know. I want to touch that. What is the Kenya government doing? Due to the presence of coronavirus cases, all public gatherings, rallies, crusades, and meetings of the national nature have been banned. These include building bridges, initiatives, and all that stuff. Even church, you see, they are withholding the church meetings and gatherings. Learning and education institution has been suspended. The government is suspending even travel for all persons coming into Kenya from any country with reported coronavirus cases. Entry level 4-5 in the hospital in the country will have an isolation ward funded by the Ministry of Health and the World Bank. Is there a vaccine or treatment? Currently, there is no vaccine for COVID-19. For those affected, supportive care and in serious situations, hospitalization may be required. Antibiotics do not work on viruses such as COVID-19. Antibiotics only work on bacterial infections. Is there anyone more likely to catch COVID-19? Older people as well as people of all ages with chronic medical conditions such as high blood pressure, heart disease, lung disease, or diabetes appear to develop serious illness more than others. What should I do if I think I have it? First thing to do is to stay at home and try as much as possible to isolate. Avoid public areas or transportation to prevent further spread. Cover your mouth and nose when you cough and sneeze, and wash or sanitize your hands constantly. A call center has been set up by the Ministry of Health to enhance communication on COVID-19. Members of the public can reach out by dialing 719 for audio messages or for short messages. This will apply on networks. Note on discrimination. Fight stigma and discrimination by providing social support and learning and sharing facts, not myth. Yes.